I'd like to welcome everybody to tonight's event. It's the evening in Melbourne, and of course it's lunchtime in India and breakfast time in the UK. So we do have, I know, a broad audience. So I want to say good morning, good afternoon, or good evening, according to where you are. I'd also like, as is important in the context of speaking from Melbourne, to acknowledge the traditional owners of the land upon which I stand, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present, and emerging. My name, as you probably know, is Craig Jeffrey. I'm the director of the Australia-India Institute and a professor of geography at the University of Melbourne. And it's a real pleasure to welcome you to this evening's event on humanitarianism in South Asia. It's an event that is part of the Australia-India Institute's India Week. We have 15 events over the course of this week, and although we're now towards the end of Wednesday, there's still a chance to experience other events in our program, and I'd encourage you to look at our website and find, if you haven't already, other events that might interest you. They're extremely diverse and range across a wide range of topics. Having said that, I think tonight's event is one of the jewels in the crown. The Humanitarianism in South Asia event is one that various scholars at the Australia-India Institute have been planning and thinking about for a great deal of time. And I'd like to acknowledge Nathan Grills, who's going to be chairing the question and answer today, and his input in terms of the evolution of this event. And I think what's also extremely exciting about this evening is having two really superb guests and speakers to really sort of give us, I suppose, Cherian, Emma, if you allow me to characterize it like this, sort of provocations in relation to this topic that can then generate a good deal of discussion. And the structure of this evening is going to be that we, after I've concluded the introduction, Cherian and then Emma will speak, and they will speak for a relatively short amount of time, leaving a good amount of time for Q&A, and Nathan Grills will be moderating that. So I'd like to begin by giving an introduction to the first speaker, Mr. Cherian Thomas, who's the regional leader, South Asia and Pacific region at World Vision International. Someone who's extremely well placed to discuss this topic and to give us some really interesting insights into thinking about humanitarianism across the South Asian region. World Vision International, for those of you who don't know, I think most will, is a humanitarian and development organization working for the well-being of vulnerable children and covers 10 countries in Asia and the Pacific Islands. Mr. Thomas has earlier served as National Director and CEO of World Vision India. Mr. Thomas has over 34 years of experience in very diverse fields, and before joining World Vision India in August 2015, he served as a CEO of the IDFC Foundation, where he oversaw the working of the foundation and its joint ventures with the governments of Karnataka, Delhi, and Uttarakhand. Cherian comes with extensive experience in the fields of infrastructure, banking, project finance, policy advocacy, capacity building, program support, and advisory services for government clients and community engagement programs. Cherian, I think one of the wonderful things about these kinds of events is meeting people whose work and activity straddles academia, the third sector organizations, government, and your career and your expertise exemplifies that kind of commitment to building bridges and to creating opportunities through developing lines of collaboration. So I'd like now to hand over to you, and very much look forward to hearing your perspective. Cherian, I believe you're still on mute.
I suppose you can hear me now?
Yes, that's great. Thank
Yeah,
you.
thank you. Yeah, sorry. It wasn't as clean a segue as I wanted it to be, but in any case, thanks so much for those kind words of introduction. And I have a presentation just to kind of bring a context to what we are discussing, and the context that all of us globally are going through, whether we are donors, beneficiaries, global north or south, are all facing it, is the COVID situation. So it's a global problem, unprecedented, and it's in many ways affecting us as we have never been affected before. It's killing people, spreading suffering, turning people's lives upside down. It's also more than a health crisis, and what started as a health crisis has now become a huge humanitarian economic crisis. Asia's children, the most vulnerable, are on the brink of quite severe malnutrition, increased disease, heightened risks to physical and emotional safety. Mental illness is one of the areas which is quite challenging at this point. Uh, World Vision began its response in China, and its response now covers all the places where we are working. And it's moved from being a response to the health crisis to being a response to the health and economic crisis, moving from being a short-term response to being a larger recovery and programming response as well. And just in order to understand, for instance, what we really ought to be doing in the longer term, we ourselves, to inform ourselves, did what we call rapid recovery assessments across 15 countries in the Asia Pacific region. And this covers the most vulnerable children, the most vulnerable communities where they live, to give us a sense of which are the greatest needs. So when we talk of, therefore, humanitarianism and what humanitarian responses can be, it's very good to always know the context and what the great needs are, and that these needs are backed by solid research from the ground. Now, because of the fact that we are a very grassroots level organization and we have a fairly extensive presence in many of these countries, we were able to cover, even in a very quick, rapid survey, 36,000 countries in 13 countries. Two of the countries are not yet presented. The results are still being done. But some of the big challenges and the big areas where the challenges exist are clearly areas like livelihoods, areas which have to do with access, areas which have to do with children's safety, children having to take a break from where they are in terms of their studies, children having to beg or take up high risk jobs. And these numbers can be quite high. For instance, in Bangladesh, this is as high as 34% from our communities of children going back into working. In terms of challenges to food supplies for various reasons. And as I just share a few of these slides, you would get a sense of where the needs are and where the needs have emerged. Uh, like I know this is the Asia, the Australia India Institute, but being South Asia and being part of the Indian subcontinent, I thought it would be useful to look at a bundled set of numbers from the Indian subcontinent, and this is what we see. So, in terms of methodology, for just these four countries, we had close to 20,000 people being interviewed. There were 213 locations, these four countries, and a fairly large number of people, a large number of men, women, boys, girls, probably in equal proportion being done. And it sometimes helps to look at children very, very critically in this part of the world, because 40% of India are children below the age of 18. About 60% of the country are youth and children below the age of 30. So these are the broad areas where we find thematically the greatest needs, again viewed from the lens of children and children's well-being: livelihoods, food security, water, sanitation and hygiene, health services, child protection. In terms of livelihoods, fairly significant numbers, and these were surveys which were done during the months of May and June. Very significant levels of people being affected by loss of livelihoods or significant drop in income because of livelihoods. I mean, the numbers are as high as 77% in rural areas, 85% in urban areas, and the urban situation is probably worse because of the whole peculiar problem of migration from rural areas. And so it's often the daily wage itinerant workers who have been the hardest hit. And again, seeing very significant drops in income and across countries, whether it's in India, whether it's in Nepal, whether it's in Sri Lanka. Movement restrictions, now they're getting better, but nevertheless, movement restrictions have continued to pose a challenge. And we are finding that because of movement restrictions, there have been it is further compounded the economic crisis. The economic crisis has led to not being able to afford basic household expenses, and many have taken loans, many have used savings entirely, borrowed from friends and neighbors, and therefore a situation of distress. So this is clearly one of the areas in terms of livelihoods and economic distress that has affected people. Uh, Equally, in terms of food, there were initially harrowing pictures that some of you may have seen in terms of pictures that were there of the urban migrants not having food, traveling long distances to get back to their homes. It's got a little better, but nevertheless, affordability to a certain amount of basic food requirements, food supplies, it continues to be critical. Water sanitation and hygiene, not as bad as we expected, but nevertheless still significant at around 25%, still not having the needed access. Health services is where, for a lot of people, the access to primary health care, access to medicines has also come down. And this will continue to be a challenge as long as there are a certain degree of restrictions that are in place to people's movement. There is a fair amount of information, though, however, and I think in many ways, whether it's governments, whether it's non-government agencies, there is a fair amount of information that has gone out in terms of awareness. Now, whether the awareness translates into action is continuing to be a challenge. For us, again, from a child protection point of view, this is again an area which is very, very critical, where children either get back to work. We have not in the initial months of the lockdown seen as many children being trafficked. Trafficking was never such a problem, but it's getting to be more now that the restrictions are eased. Early marriage in places like Nepal, Bangladesh, and India continue to be a challenge. But more importantly, children stop going to school, higher amount of abuse, increased stress on families, and also a lot of worry about the fact that there would be challenges to their mental well-being. Now, governments have responded in different ways, and you would find that some countries have responded more in terms of how they've been able to support this process, some not as much. But nevertheless, no matter how much governments do, there would continue to be a challenge of adequacy of resources. And that is where the whole humanitarian response, that is where private funding, private philanthropy will continue to be important, directed thoughtfully and sensibly to the areas of needs that we have. So this is the picture, this is the context in which we see a need for humanitarian response. It doesn't end now. It I think unfortunately will continue for the next several months. Hopefully not too long. And depending on how quickly a vaccine is available and how quickly the vaccine is made available to the poorest of the poor, this will continue to remain a crisis. So more during the discussion time. Thank you.
Thank you so much, Cherian, for a superb overview and giving us, really an up-to-date picture of critical areas. So we really appreciate that. And I know lots of people will have questions. So thanks for getting us off to such a great start. I'd now like to introduce an old friend and someone whose work I hugely admire, and who's also very influential, I should just say, in sort of teaching me and getting me to think about an academic career, and has been a constant sort of inspiration and guide. So it's a particular pleasure this evening to welcome Dr. Emma Mawdsley from the University of Cambridge. Emma is a reader in human geography, and she has worked across a number of institutions in the UK. She started working at Durham University, worked at Birkbeck before joining Cambridge. And Emma's research began in the early 1990s in Uttarakhand in North India, where she was studying a regional movement for the establishment of a separate state of Uttarakhand, which of course then occurred. And Emma's analysis of that movement was really important at the time in terms of understanding questions around regional identity, political mobilization, and the relationship of those processes to issues of social inequality. More recently, she's moved to be writing about middle-class environmentalism, with the environment remaining a really important theme of her work. And then over the last decade, she's become very notable and prominent in terms of working on South-South development cooperation. And I know many of my colleagues and students have been following this work and learning from it very closely. And this the interest in South-South development cooperation has a particular focus on South Asia and India, but it's not exclusive to India. Most recently, she's led research on global development politics, including specific work on the UK and on the growing role of the financial sector and the private sector in processes of development. And since 2018, Emma's been leading a DFID, now FCDO funded program, the India-UK Development Partnership Forum, which is aimed at improving India-UK development cooperation with partner countries. So working very much on the interface, again, between academia and policy. So Emma, you're also superbly well qualified to be talking about this topic, and really very excited to hear your thoughts. Over to you.
Thank you, Craig, and thank you for those very kind words. And it's a real honour to be speaking with Cherian Thomas and, of course, at the Australia-India Institute. I don't have a presentation, but I just thought what I would do is focus a few points, really provocations, interesting things for us, I think, to consider about India's international identity as a provider, as well as a cautious recipient of humanitarian and disaster and pandemic-related assistance. But actually, I thought I'd start by saying that Jonathan Bulls, who is formerly of the Australia Institute, India Institute, and who's now working in the IUK that Craig mentioned, drew our attention yesterday to a very interesting development. An Indian charity called Akshaya Patra, which feeds, I think, around 5 million children a hot lunch in India, has now set up in the UK and is feeding hungry British children a nutritious, warm vegetarian meal. And what struck us all about this, and we're yet to find out a little bit more, is it's a demonstration of what we're looking at, of not just growing South-South development partnerships, but South to North learning, and indeed South to North loans and action. And one of the striking things about this charity was they were very immediately aware, I mean, they've really built on their experience in India, and to observe that some of the anti-child hunger issues in the UK, of course, which has been exacerbated by COVID, was with the best will in the world, often providing sugary drinks, sugary food, which was not very good for the children. And so they could bring their Indian experience to the UK. Now, I'm very interested to see how this works out, because I think it's very important that the UK and other countries think of themselves in a global network of knowledge exchange, learning and experience. So what then about India's role as a humanitarian actor, particularly in the region? Of course, it has a history of also extending its work to sub-Saharan Africa and elsewhere. There's lots of work on this, and I suppose in a way I'm coming at it from the point of view of South-South cooperation. I'm not a particular expert on humanitarianism, but that divide is one that tends to be stronger in the West than in many Southern partners. And Southern partners have challenged the divide between relief and development, and they are, I think, absolutely right to do so. And many people in the humanitarian field would agree that the West has historically been too binary about relief and disasters and longer term development. So India is one of the countries that's very helpfully, I think, not made that such a distinctive difference, so that interventions might be thought of as longer term, or 3 years later still building houses for, say, displaced people in Sri Lanka or in Bangladesh, might be in Nepal, still comes under disasters and relief. So some of the things that have emerged recently, of course, COVID has been a very big driver, but I'm really, I suppose, picking up on some other things that we might then discuss in relationship to COVID. So that one thing is that India is quite rightly able to insist on its own experience. So as a country that experiences many of the disasters that are very prevalent and intensifying and growing in Southeast Asia, South Asia, floods, cyclones, droughts and landslides, heavy rains and so on, that it can draw on its domestic experience. And of course, in many ways, it has incredibly impressive response, and the institutionalization through new disaster management institutions in India have been very good. I think we have to be a little bit careful of that. So there's a nice paper by, what's his name, Katok for the Delhi Policy Group. And he notes that when there was an exercise with the BIMSTEC group on disaster management and preparedness, that the Ministry of External Affairs passed it to the Ministry of Home Affairs, who commissioned the National Disaster Management Agency. And while they did a super job in showing a boat rescue and a building evacuation, they didn't really, this was all domestic experience. And of course, in fact, when you go to, when disasters unfold, it's the military who are often, the Indian military, who are the key first responders. And they have to work within a much more complex political situation and a much more multi-agency situation. And neither of those things really came through in the BIMSTEC exercise. So I think that that domestic experience does indeed put India give it an awful lot of expertise to share, but there has to be care about not assuming it's a simple transfer. We see the role in terms of India's external international humanitarianism. The Development Partnership Agency was set up in, the Development Partnership Administration was set up in 2012 to handle India's external development partnerships. And that too has strengthened its institutional role. We see lots of debate about India as both provider and controversially as increasingly refusing assistance. And I think everyone in the audience will know about the fact that the government of India refused assistance from the Maldives, Qatar and UEA, for example, because of the flooding in Kerala. In the past, it's refused assistance from Japan and Russia after Kashmir floods. And of course, very famously, the 2004 tsunami response marked this really quite significant shift in India's sort of identity and positioning, and how it chose to handle a major disaster response. I think that's problematic. And the reason I say this, I recognise that, of course, as we know from the work of Benedict Korff and many others, that to be the recipient of aid or humanitarian relief is often to be deeply disempowered. We know that India is one of the many countries the West has patronised, that the West has pushed around, imposed conditionalities, and in many ways, I've written a little bit about the way in which aid and relief can infantilise, and it can be a tool of really problematic, very sort of Janus-faced intervention. Now, India, like lots of Southern partners, really reclaims that ground and talks about the solidarity of exchange. And I think that that's a fabulous message, located very strongly in third worldist experiences, ideologies, Bandung and so on. Now, of course, that's changing a lot under Modi, but we see from the example of the Nepal earthquake in 2015 and the response there that there is a danger that India simply repeats some of those hierarchies and inequalities. And some of the media, of course, very famously seem to do that. What strikes me about this is that if India says there is no shame in our partnerships with Kenya, with Bangladesh, with Afghanistan, then there should be no shame either in being part of that recipient, that partnership where you are. In Latin America, for example, every country both gives and receives assistance. And there's a saying that no country is too rich not to give, and no country is too poor to say no. And I think actually India would live up to those brilliant principles of the Panchayat principles and of third worldist solidarity by accepting assistance from partner countries as well as providing it. And if we look at the actual figures provided, then we know that the there is still a desperate need in, for example, the flood response in Kerala. So I'll just finish this up by talking a little bit about the nature of disasters. COVID-19 in many ways changes everything. And it seems to me that while much of the disaster literature to date has been around, often the distinction is made, I think wrongly, between natural and so-called man-made. Of course, there's a very strong interplay between those two things. But I think the importance between fast and slow is going to become more and more important. And I think it's a very fair bet to say that the next major humanitarian crisis to emerge will be around antimicrobial resistance. And this will be a bit like COVID-19. This was a pandemic foreseen, a pandemic foretold. There was no shortage of people who foresaw a pandemic just like COVID, and it happened. The next one, I think, is going to be AMR. It will unfold slowly, inexorably, deeply dangerously, and it will have similar implications in many ways of death, potentially lockdown and travel restrictions that will fall poorly on everyone. So I think that learning, having honest conversations is critical about what does and doesn't work, on whom the cost falls. Learning from our African partner countries, who've often handled this not perfectly, no one can, but rather well. And I would like to say that we, whether you're the UK or India or Mozambique, we all have things we can learn from each other about humanitarian response. Thank you.
Thank you so much, Emma. That was another superb presentation, and I know that it's going to generate a large number of questions. So I'll hand over to my colleague, Associate Professor Nathan Grills, to chair the questions. Nathan, over to you.
Thank you, Craig, and thank you, Emma and Cherian, for sharing. It would be great to have some really broad discussion about some of the issues that you've both raised, and also if people have other questions that relate to the area, please feel free to ask those questions. Simone has put in the chat dialogue about how to ask questions, but please feel free to type your question in the chat function and we can moderate those. Or if you want to ask your question in person, please indicate to Simone that you want to do that, because it'll take some time to organise that. But yeah, probably easier if you type your question in the chat function. So I'm sure lots of questions, and I look forward to hearing them. Maybe I'll start with a question for both of you. I think in the current environment, we're seeing that the humanitarian crisis, which Cherian has probably outlined clearly, is significant in India and has probably magnified underlying humanitarian situation in India. So if we say we potentially have gone backwards and the need is greater, maybe Cherian could comment on that if that is the case. How does that play out in the current environment politically, where there's the recent FCRA amendment, which probably may limit some of the humanitarian assistance coming into at least the NGO charity sector? Is that going to be an issue? And it's just Australia. I mean, the timing is unfortunate in some ways of that amendment, in that it may potentially limit some of the support that might be coming in. So I guess, firstly, do you think it'll make an effect on the humanitarian support that's coming in? And I guess, secondly, what's the background to that amendment coming in?
Yeah, there is. I think governments realize, and the Indian government also has realized, that there is also very limited fiscal room to raise the kind of resources that it needs. However, as Emma very rightly pointed out, that if you look at the whole political situation over the last few years, last few decades, I would say, on humanitarian, the approach to humanitarian funding, as well as the growth of the Indian economy itself, these have had a certain degree of correlation. And I think the confidence that India had that it can take its own problems, I think it would be foolish if it just remains hollow pride and we are unable to, with humility, be able to accept, like I think it was very rightly said, none of us is too rich or is too poor not to give, or too rich not to receive. And I think that's something that the current economic situation in India is actually quite an important test. Uh, how long before we would find the ability to do that? How much more into a corner politically we need to get pushed is something that time will tell. But there are some lessons that India can learn from Bangladesh, which was seen as a basket case. It started its life on aid in the year 1971, and it has grown to very, very, despite a lot of political turmoil, a lot of economic difficulties, being very low on the Human Development Index. I think Bangladesh has done very well in the last decade, at least, or maybe the last couple of decades, in dealing with various social problems, various social issues, uh, as well as economically. I think for the first time, in terms of IMF estimates, Bangladesh's own per capita income has exceeded that of India. And of course, Indian economy has seen a very sharp contraction in the last quarter. But I think this is an important lesson for India as well, to be able to see and learn. Um, and like you said, yes, it's right that sometimes uh, tends to be a little. This tends to be a little. From a time point of view, it's not the best of times to have had this FCRA amendment. But the FCRA changes should probably be seen as a series of what is happening. What it might do, to my mind, is to probably enable the growth of more of Indian NGOs who are at the grassroots level. It would make many of the international NGOs who work there start looking at themselves, also getting involved more deeply at a grassroots level. Otherwise, so the easier method of raising money, managing projects, and letting the local NGOs uh, work at the grassroots level might change. And in some sense, World Vision is in a good place despite these changes, because we have always been a grassroots level NGO. We've always been in the community, working in the community, our staff living in communities. I think that's the big change the larger NGOs, our peers, have to make, because most of them work with partner NGOs. And equally, it allows NGOs also perhaps a time when they can consolidate. And I would think that what happens in the corporate sector might slowly start happening in the non-government sector as well, as a result of it, because we have over 3 million NGOs in India. I think it's 3.4 million NGOs that are registered. That's an extraordinarily large number, and sometimes often too many people chasing few resources, and that's not really the best place to be in. So hopefully, what could be seen as a threat can also become an opportunity for the NGO sector to reinvent itself, to rediscover itself, and find new ways of working. And again, what is happening in India is not an isolated example. I think there is shrinking space for players like us globally in many countries, even in the developed economies. So I think we really need to, at a micro level, be able to find solutions, and perhaps partner far more than we have done in the past. Nathan, you're muted.
Maybe just to follow up on Emma's comment as well about the bidirectionality of aid and India being a donor as well. How's that played out in the current crisis around COVID? Has India been able to provide assistance, or has it made some suggestions that it would provide assistance to surrounding countries or other players? Emma, I'm having trouble hearing you.
Oh, I'm sorry. Can you hear me now? Yes, and in fact, one of the researchers on the IUK project, Supriya Roy Chowdhury, we've written a report on India's COVID diplomacy. So if anyone wants to see that, I'll very happily, you can find that on our website. Yeah, so India, of course, has been very active. Again, a bit of giving and receiving in this particularly interesting moment. Fascinating set of perhaps slightly elbows out with China in particular. Lot of development diplomacy going on there. Of course, it's not just the state. I was thinking about what Cherian was saying. We see examples of the Parsi community reaching out to other Zoroastrians in Iran, which is suffering very badly from COVID, and other examples of non-state assistance and support. Of course, lots of migrants and trying to send back remittances and diaspora and so on. And I agree with Cherian. I think that there's a very concerning trend. I think the reasons for the kind of growing suppression of independent voices is deeply alarming. But there is at the same time some positive things that might come out of this, including building the inward, the grassroots, the sort of organic rooting of some of the sort of bigger NGOs. I mean, as Cherian says, there are 3.4 million NGOs, most of which are grassroots organizations, but perhaps re-embracing the bigger ones too, and finding a space. I very much hope for the advocacy, the rights-based voices in amongst them. And you know, this I know this is a tricky territory, but if honest conversations are not had politically, in the media, in society about COVID, then, like I believe very strongly, this isn't going to be the last pandemic. It's not going to be the last big, slow, unfolding, complex disaster. Now, if an honest conversation can't be had about the various costs and consequences of different routes of where co-learning might come from, then we are all going to be in big trouble. And let me say, the UK is absolutely in the same position. Nobody in the UK can speak from a position of superiority on this one. Yeah, I'd agree with Cherian there.
Do you have a sense, either of you, of the scale of the aid in the current crisis, or I guess in India in general, to those who are living in multidimensional poverty, for example? Say there's over 300 million people. How much of that aid to that group of people is coming from international sources, or how much of it is locally coming from local sources? Like, do you have a sort of a sense of the breakdown, or is it playing, is international aid playing a big part in able to, getting services to that poorer part of India?
So, see, I think in terms of international aid coming in, if you look at the entire aid coming in through private non-government organizations, the estimate of what is about $3 billion is what could be what is available, but that's for a whole range of areas. It's not just a crisis. It's for development. It's sometimes quasi socio-religious. There's a whole range of where money flows. In terms of development agencies, I think India has seen far more limited development assistance than many of our neighbors. I mean, even in World Bank scheme, even in World Vision scheme of things, Bangladesh has a larger budget than World Vision India. That's also reflective of the environment in which we are. But it's equally reflective of the way government of India has been able to put resources into it. Having said all that, if you look at even fundamentally where the money comes from, tax to GDP ratios in India have always hovered around 20%. It's twice that in the US or in the UK, and in France it's probably even more. So, I mean, we've done some studies on that in the past, and so it gives you very little leg room ultimately for government to be able to invest the kind of money it needs to. But equally, for that kind of aid to flow from development agencies globally, I don't think we have that quantum of resources available at all. So to that extent, what really happens is that the quality of service, if I may use that word, suffers, and therefore we are always underrated, and we are therefore to some extent looking to see growth happen, where over a period of time, simply the sheer growth in the economy would result in a certain degree of change. And that's what India has seen because of fairly high growth rates over the last 3 decades, where we've seen far more people come out of poverty in the last 30 years than in the first 40 years. So that's it. But the problem is, today we are in a fairly difficult situation where that growth itself is threatened, and whether and some of it is not necessarily only because of COVID. It was also because of certain economic actions that we took before that, and and which were perhaps quite unnecessary, but they have been expensive and they've been costly. And so I would see therefore a lot more of people in many parts of the in this part of the world getting back into poverty. So finding a lot of the gains that we had made in the past actually get nullified, and to see a lot more people slide back into poverty. That is something that we are going to see. Countries like Bangladesh, while the economy is managed better at one level, are also going to suffer because of lesser remittances coming home. And I think there's a huge amount of crisis in countries like Cambodia, Bangladesh, because of the lower remittances coming into these countries. So there are these challenges. But I would think at the moment the bulk of the money coming in, I wouldn't. I mean, there are different numbers which the Indian government has also talked about, for instance, as to how much it would invest. It's part of a larger plan of investment. It's also a larger plan of stimulating demand, not entirely targeted only at COVID and in terms of social protection measures. Some of it goes in there as well, and a lot of these have been analyzed. But but the bulk of it is really domestic, not very significantly international. And that is where countries like Bangladesh and Nepal have a challenge, because they have not been able to invest as much locally as they could. That's what the last slide of mine actually had. So they are facing a challenge there.
Thank you. I'm enjoying the conversation, but if others wanted to also ask questions, please feel free to post them. Emma, did you want to add anything to that in terms of, I guess we talked both in terms of private and state aid in a humanitarian space? If that was stopped overnight, how would that look in India? Or is there still a significant need right now? I'm not hearing you again, Emma, sorry.
Sorry, it seems to take a while. Is that okay?
Yep.
Yeah, I can't honestly say I know the answer to this question. I think what we see at the moment is India probably is giving more than it's receiving in pharmaceuticals, PPE, and other things. And I suppose in a way it's such an extraordinary global moment that while there is an immediate need, the bigger picture will be that long-term reconstruction. And what sort of reconstruction? Is it going to accelerate the financing of poor carbon-oriented infrastructure? Are we going to try find ways of building jobs or creating a different world of employment and income, or non-employment and income? So I think in terms of the immediate need, India could meet that, but it's going to rapidly move to that economic reconstruction that is in many ways, I think, going to be the much bigger challenge, and one in which regional and international agreements on debt, on financing, on if we could possibly try and use this horrific moment to genuinely get behind more building back greener and better, and not make this just a slogan. It moves us so far out of, in some ways, of the world of humanitarianism and aid, the sheer scale that there is a desperate humanitarian need right now, but it's going to put other demands on us very soon.
Thanks, Emma, and thanks, Cherian, for your answer on that question. Craig, you've asked a question, and since you have a microphone and a camera, maybe you can ask it live rather than me repeating
it. Yeah, sure. Thanks, Nathan. I wondered, Emma and Cherian, if you could talk at all about the extent to which countries are currently partnering with India to provide aid to other countries, and whether that's likely to become more common.
Yeah, actually, very early in the COVID response, India had announced setting up of a SARC fund and made a voluntary contribution, I think, of $10 million to the SARC emergency fund.
Right.
But I would think more than hard assistance, what India has done is also a lot more of soft assistance, where, for instance, sending teams of doctors to Nepal and the Maldives to be able to export a certain degree of food grains, medicines to Afghanistan. It has actually, it's in some sense, its cooperation has gone beyond just Asia, but also to Africa, to Pacific, to Latin America. Uh, Equally in terms of supplying certain kinds of drugs which are believed to make a difference, whether it's hydrochloroquine or whether it's paracetamol, a fair amount of this going out by lifting a domestic ban on the export of these. And so there has been, together with the WHO, a certain element of global cooperation with a range of countries
Mm.
that India has been doing. Uh, yeah, but how much all these would add up to in terms of quantum, in terms of monetary value, if one were to monetize it, I don't think it will be that significant. Our own internal stimulus package was about $250 billion, but a lot of it was in certain kinds of projects that were already in the pipeline, and some of which are more COVID targeted and COVID specific, but obviously the benefits in terms of hopefully reversing the trend of unemployment, very rapid growth in unemployment that we have seen in the country, uh, hopefully getting impacted by some of the schemes of the government, would come into play in the next few months. So the next few months are going to be important tests, and I would see much fewer physical restrictions and movement restrictions, and that's already happened. We will have to learn to live with a certain degree of, because of that, because of the economic response, we will see the health challenge continuing to be there. There'll be a lot more of infections. Hopefully, a lot more people will get cured, and maybe in the next few months we'll have the vaccine available. So that's really how it is. No one really knows the answer to these some of these questions.
Yeah, if I can draw on the report that Supriya Roy Chaudhary has primarily written with the IUK team, she has divided India's response and COVID diplomacy, if you like, up into normative contributions. And as Cherian says, some of these have a longer history. So normative contributions around health, multilateralism, health as a global public good. Material contributions, which have included the supply of drugs, of medical professionals and emergency medical equipment. And again, it's worth remembering that this is a new landscape, I think, a new geography of aid, relief, and so on. I mean, Médecins Sans Frontières set up a camp in the middle of Brussels. This is, I think, a potentially quite revolutionary moment. I do hope so, in which we start to think of ourselves as a world together. So Supriya talked about normative contributions, material contributions, and then knowledge contributions, which India is very well placed to do. So really then, I think that there are dangers, of course, that it just gets locked into the US-China, India-China kind of competition. This isn't going to help anyone at the end of the day. And there may be domestic limitations or challenges to materialize this, but definitely, clearly India is going to be at the heart, particularly around because of its manufacturing capacities of global responses. The underlying politics then go a lot deeper, but I would hope that India would really have global leadership, in particularly around the normative shifts towards global public health. To do so, it definitely needs to address some of the health issues, public health issues within India. We know that it has one of the lowest per capita spending on health. So this is, I think, a remarkable opportunity. And I think actually, again, to flag up the AMR issue, this is something that India, it must see coming down the line, and now is a good moment to seize this, because the country that will suffer the worst is going to be India. But it will also find itself, it will be, if you like, I'm not sure this is the way to put it, but it's going to be the Wuhan of AMR if we're not careful. And that's a reputation that no one wants to have. So I think this isn't really, I mean, it's very, we have to be careful about saying that crises are opportunities. We know that crises are often opportunities for exploitative and structures to double down and dig in deeper. But there are potential possibilities for trying to think through our geographies of aid, assistance, development, health, and so on.
Thank you, Emma. Thank you, Cherian, for those answers. I think it's a fascinating area. You have scared me with your prophecy about AMR in the next pandemic, but we're aware that in Australia, a lot of our AMR, antimicrobial resistant bacteria, come from South Asia. So it's, yeah, I can see how it could, if you had some bacteria that became more virulent and more difficult to control, you could see how it could lead to border closures or strict quarantining, similar to what we're seeing now. Let's hope we've learned from this pandemic and we can somehow address or stop that happening. But yeah, thanks, Emma.
I mean, I would say is that, again, this pandemic was foreseen. There's a brilliant series of essays in Transactions of the Institute of British Geographers on how geographers over preceding years, papers that have engaged with pandemics. And if you look there, I've got to fly the flag for geography here. The pandemic, it was foreseen, the racialized response, the particular toll on health workers. Geographers have been writing about this, and of course many, many more public health officials, epidemiologists, medics have been writing about this. So this pandemic is not a surprise. So more than a little disappointing how very few countries have managed to handle it well. And it's fascinating to me that in part, what we see is because of the really racialized depiction of many of these diseases as tropical, the West has failed to engage sufficiently, and as that's been part of the problematic response. So yeah, let's not overlook the next one.
Can I ask one follow-up question there, and then I might hand back to Craig. In terms of the pandemic cutting off a lot of international travel, has that accelerated the move towards more independence or more autonomy and being able to manage the whole response and the humanitarian aspects in a place like India? Because it's more difficult to have external people coming in and providing advice, or even funding has been more limited. Do you think that's actually led to a more domestic response from India in this pandemic?
The very nature of the pandemic was such that the need for people coming from outside and responding, as is sometimes seen in certain global responses, is just not present, because this is again one pandemic where the countries who traditionally are seen as donor countries and countries which are traditionally seen as recipient countries have all been equally ill hit. So there's no one coming to give aid or coming to render any kind of material assistance. So that really didn't happen. So it had to happen from within. So that is one very fundamental difference. And everyone, countries, whether it's the US, the UK, all of Europe, Australia, I mean, every country had to. So that really didn't happen. The challenge that many of us did face in country was that ultimately to deliver assistance, while a lot of things can be done virtually, at the end of the day, last mile assistance has to be in the form of something that is material. And now and that is where the switch has happened to a large extent in many places. Bangladesh and India are two countries where we've seen a fair bit in our own work in World Vision happen, where we've switched a lot from what we used to do in the past in terms of directly delivering material assistance to cash and voucher programming. Now that was done. Countries like Sri Lanka, what they did was they worked with the government very closely, and countries like India and Bangladesh did as well, and Nepal as well. We worked with the government very closely, and the government became the mechanism through which the last mile delivery did happen. Of course, in countries like India, where we saw a whole new problem with migrants returning from urban locations to rural locations, and their condition was very pitiable. There actually we actually found civil society respond very positively. So there were some very difficult stories initially, but I think overall within a very short while, civil society responds, whether it's faith-based organizations, whether it's charity organizations, with NGOs like ourselves. I think the response on the ground was quick, and there the government also worked very closely with many of us in many places in making that happen. But that is not to reduce that, not to negate or to in any case understate the level of pain that many of them suffered for some time. That is quite high. It was terrible in the initial days.
Well, thank you, Cherian, and thank you, Emma, for your insights. I really enjoyed listening, and I'll hand back to Craig.
Thanks very much, Nathan. And let me echo what you've just said. I mean, Cherian and Emma, it's been really so interesting listening to you both. And I feel like we would really profit from having both of you back in maybe 3 months' time, and then again in 6 months' time to sort of keep us updated, because this is moving so fast, and you're just in some of the visual data that you provided, Cherian, and in some of the case studies and comments you made, Emma. I mean, it's very striking that a lot of sort of received wisdom about how humanitarianism sort of takes place, if I can use that sort of geographical idea, is being overturned or needing to be rethought. And so it would be wonderful to hear you both again. But I don't want to prey on your good nature anymore by trying to secure that now, but maybe we'll follow up. It's been really very, very interesting, and I'd also like to thank Nathan for helping to conceive this evening, and also for chairing the Q&A, and of course Simone Traglia and my colleague at the Australia-India Institute, and also Mariana Saris, another colleague at the AAI, for all their hard work at pulling India Week together and helping to arrange this event. And so thank you again, Cherian and Emma, and I'm glad you didn't have to get up too early in the morning, Emma, for this event. We really appreciate you getting up quite early and coming and talking about your research. And I wonder, Emma, did you put a link to the piece that you mentioned in the chat?
Yeah. So that's
okay. That's in there. Great. All right. So people have got that. This has been recorded, and with your permission, Cherian and Emma, we may publish this later, but we'll ask you about that first. But thank you also to everyone who participated this evening. Bye bye, everyone. Thanks.
Thank you so much. Thank you. Bye bye.
Bye bye. Thank you.